Hi, I'm Dr. Georgia Witkin.
And I'm Kimberly Pauley.
And I'm Kimberly's mother.
And I'm the mother of 2 boys.
Which makes me Gigi for Grandma Georgia.
So welcome to Gigi and me.
We talk about everything.
Well, the reason I talk to my mother about everything is that she's a professor of psychiatry, professor of OBGYN, she's written 10 books on stress, and she's a Fox News contributor.
And Kimberly is a lawyer, a columnist, a college professor, and pregnant.
So we're going to be talking about pregnancy. Please join us.
We're going to talk about sex and pregnancy. Didn't even go.
Right.
First, introduce yourself.
Kimberly Pauley. I have 2 sons, and I'm pregnant with my 3rd son.
I'm Jenny Vynerib, and this is Oliver. He's 3.5 weeks old.
I'm Susan Krauss. I have a 3.5-year-old son and a 2-week-old son.
Okay, here's the Hollywood version. You're pregnant, your skin is glowing, your body is warm, your hormones are just at its highest peak. You can't wait till your husband gets home. You're calling him during lunch and saying, can you come home? This is the time where there's no baby crying and you want sex morning till night. Is this a Hollywood fantasy or your husband's fantasy?
I think it's husband's fantasy, actually.
Yeah, I was about to say.
We were saying before that all of our husbands, before we got pregnant, had heard that version. So I think it's like, although it might be true for some women, I think it's almost blown into mythical proportions, and that's all they hear before their wives actually get pregnant.
Yes,
Totally
right?
agree with you.
So what's the reality like?
I think it's more just a little less interesting than that. I mean,
It's nausea, it's fatigue.
Yep.
It's the backache.
It depends on where you are in your pregnancy, because
Yes, it
at least for
changes.
me, I threw up for the first 5 months
Yeah.
of each pregnancy.
So you don't want to do anything.
Right, you don't want to talk to your husband or
Right.
anybody else, let alone have sex with anybody. But I think also, and some women don't experience that, so each woman is different. And I also think it depends where you are in your pregnancy, right? Because
Right, then at the
hormonally,
end, you don't even want to look at yourself, let alone have anyone
Right.
else look at you. So,
Right.
yes.
The
Hormonally,
middle
it's
is
the
your best
second-
shot.
Hormonally, it's the second trimester.
That's your best window.
Yes, your hormonal balance is just about right.
Where that
but-
myth could be true. But
Yeah,
And it
but
can
that's when your back
vary,
is
yeah.
hurting
And it can vary, I find, like day to day too. Like some days you can feel very sexy and attractive, but then the next day feel totally the opposite of that.
Absolutely.
So it's not so consistent necessarily.
Did you feel sexy when you were pregnant? I mean, there are men who find pregnant women just very, very sexually, appealing.
and I have so many friends who did feel really sexy when they were pregnant. And I had a lot of friends who did not feel really sexy. I think it really depends on the person. I have a lot of friends who told me when they were pregnant, they felt gorgeous, sexy, really good about themselves, amazing that they were able to produce this baby. And I think that at least for me, I have experienced that feeling. It's just a matter of how long it lasts, because then the next day, as Susan was saying, you can go back to feeling heavy and, and uncomfortable
And the baby's laying on your bladder, and that's much more important than anything else. I have men in my office, though, saying that the term is we are pregnant, but it's my wife who really is having all the fun. She's getting the presents, she's getting the attention, she's really bonding with the baby already, and she's not interested in me right now. So that, I think, goes into this sexual myth also. Maybe some of it is that they might be feeling like they're no longer first.
I think that's a big problem. And in fact, that's a big problem actually once the baby first comes. And you bring the baby home also, don't you think? I mean, I know that it's, your husband is number one, and then you're pregnant and you have a baby, and they do feel like they're pushed aside to some extent. And
Right.
sex does go along with that.
Absolutely.
It's sad, yeah. You're trying to just find time for yourself or connect, have something. It's hard to, everything's about the baby at first, so it's hard to even find time to think of doing anything for yourself, and certainly your husband and yeah.
So the sex
They
just
do
goes
feel like they
along with
fall
kind of
through
not
the
having
cracks.
time for each other. I think that's a big part of it. Just like having alone adult couple time is so hard. And even though consciously you're like, I know it's important to do, it's always the first thing to go, because you'd rather, sometimes sleep, and when you have other children, you have to give them attention, and it's like that couple thing, like going out to dinner or doing whatever, especially at the beginning. It's just so hard to do that.
Yeah, I think it's more about them getting attention than it is about sex. Absolutely. I remember when I had my first child, and I remember my husband just seemed physically so big to me. I was so used to being around something this big, and like his head was the same size as the baby I was taking care of all day. And it was so strange to me to switch gears, even physically. Looking at him was so strange for me to switch gears.
That's so interesting. Yeah, the dynamic really does change.
Yeah.
And imagine if you have intimacy all day long with the baby you're holding and 2 other children, that intimacy might be the last thing on your mind at night. But what's the deal? Do you think that, when you're dating, you make time, no matter how busy you could have a career and be taking care of your parents, but you make time to see him, and do you think that's what you have to do with babies, or is that really unrealistic? Is that just a shrink talking?
I think it would be so nice to do that, and I sometimes do feel like I should do things like that more, but it's more of a real physical exhaustion. And for me, like, intimacy is a very physical thing. So if physically you're wiped out, and if you're nursing or whatever you're doing after you have the baby too, it's hard to ask that much of yourself. It's hard to...
The transition really sucks the life out of you at the beginning.
So as a last piece of advice, what would you say? I mean, you're saying, okay, you can't really pretend that you're in a world where you can suddenly make dates, but what can you do to, make him feel like at least he's still sexy, even if you're not feeling sexual?
Yes, tell us, Susan.
Like, I don't think I have an answer for this one. I guess ideally, probably, like we were saying, to carve out 5 minutes for yourself a day, carve out 5 minutes of couple time or a conversation or a kiss or something, but it's hard.
And tell him how you appreciate him.
I guess express what you're going through and just be very clear and talk it through so that their husbands can be at least understand that it's not them, it's not about them, it's not to take it so personally, although they still have their needs, but
I think the problem comes in when when you're in transition. When the baby first comes home, it's absolutely understandable. It's the couples that take it to 1 year, 2 year, and they're still not paying attention to their spouse, and they're not getting back into their routine, and it's not a focus. I think if it's a focus and a goal, that after you feel better and the baby's a little bit older, that the husband becomes a priority again. I don't think that that's a problem.
Great last word, thanks.